First of all, I hope you're doing better. I know you had a bout of COVID over the holidays, so I hope you're doing much better.
I did have COVID. It's everywhere, I think. I think you can get it out in the community, and everybody should be vaccinated and be very, very careful. I tried to be careful myself and
Cool.
got it myself. Yeah, I was very lucky because, of course, I've been vaccinated, and so my symptoms were very mild, but you can still hear a little bit of congestion in my voice, and would be day 16, 17, 18, 19, 20. Day
Yeah.
20. When I had that press conference on Friday, people said I was very raspy. That was day 16. I
Um,
didn't test negative until day 11.
Well, okay. Well, I'm glad to hear you're doing
Mm.
better now. So
Yeah, but I'm very grateful. It was just a lot of fatigue and a little bit of congestion. And so, yeah, I'm feeling much, much better. Thank you. But it is exhausting. It's draining. And I can only imagine the impact on people who aren't vaccinated.
true.
So, yeah, no, I'm grateful. Very grateful.
So, let's get at it. I haven't talked to you in a couple of weeks, or before, even before, probably months now. Kids are going back to school Monday.
That
What do
is
you think of that?
really great news. So we did have a discussion about that with the GTHA mayors. We meet on Mondays and we talked about it there. And then we moved our conversation over to the Ontario big city mayors and even moved a motion saying that it's not our lane because you hate to give people directions on, what to do, and you're not responsible for that area in particular. But we said we certainly encourage hearing from parents, of course, that the schools reopen. We think it's the best environment in which to learn. And of course, we understand that it's difficult managing stay-at-home uh, education while you're trying to do some work as a parent as well. But we wanted to also to ensure that it was safe to return.
Sure.
Let's get vaccination rates up. Will the educators, the teachers, be provided the proper PPE? Will they have the N95 masks available? Will our students have the proper masks available? What are we doing to encourage vaccination rates? I can talk to you about those rates. And
Yeah.
also, and also HEPA filters, right? So we have been in touch with both school boards here in Peel Region, the Dufferin Catholic and Peel Public, and both are ready to go. And I know that in particular, they said everything is in place, which tells me that they're ready. They've had the masks, the PPE, and the HEPA filters in place. And it's a great relief to me. And if I were a parent, I would feel comfortable sending my kids to school, and the kids want to go. I mean, it's very difficult for them to continue to learn online, right, from home. And
Yeah.
they want to be with their friends and learn from each other.
True. You obviously know Utah. My son,
Of course.
his classes started at 8:05 in the morning, online schooling. You know what time he set his alarm for? 8:02.
Oh, well then, good for you. Take me longer than that to drink my first coffee.
I'm not joking. Let me ask you something. A little inside baseball stuff here. Like the province is not reporting COVID cases in the public school system anymore. If the chief medical officer wanted to, can he order, kind of a Section 22 order to close down schools if they see like a lot of cases around the school area? Like, is that something that can happen?
So we've had these discussions before. The Section 22 doesn't apply to a sector, but it applies to a business. So it could apply to a school or a classroom, but not all schools, right? That comes from the province. But if there's a health concern for the health and safety of our children, of our or the educators, then yes, I believe he can. Now, we both understand that it's very difficult to get the PCR tests, and we're waiting for the large shipments, the 50 million shipments that were procured of the rapid antigen tests, the RATs, to come in as well. So they're, testing the numbers. We're not even really looking at PCR test results anymore, and these numbers of people with COVID, we're not focused on that anymore. And Dr. Lowe likes to say, if the forest is on fire, does it really matter about one particular tree or which tree began? The forest is on fire, let's deal with that. But the reality is we don't have all the tests yet, and we are getting more RATs, so we're looking for that. So that's why you saw the guidance change on who would be eligible for that scarce shortage of tests that do exist now. But I think by next week that will be solved as well. and we'll have more PCR and RATs available to us.
The ICU numbers came out today, and they did say that it's the highest it's ever been in Ontario.
About 20%. So we have about 2,500 beds, and I think the number today was 477, which is up 40 from yesterday. So that's pretty significant, right? Yeah. That's a very significant increase. Now, let me just go through Trillium Health Partners. It's starting to become a little precarious. The numbers that are hospitalized and in the ICU are increasing, but also the staff shortages. It's what's driving a lot of the issues, and as a result, the closures of many of the elective surgeries. So they are treating 115 patients for COVID, and that's up from 87. But not all those have COVID, but some have other underlying health issues that they came into the hospital for, and they were tested and determined that they also have COVID. So it's multidisciplinary, if you understand. They have multiple issues, not just COVID, but there are 115 patients with COVID in the hospital and 26 of them in the ICU, and that's up 15 from last week. And we were averaging, even in the height of this, around 15 to 20. So this is very high, even for us. So, but the problem is that we have 365 staff off with either COVID themselves or are isolating because of an exposure. Sure. And so those numbers change every day, whether they're our staff or the staff at the hospitals, because now it's 5 days if you've been exposed, right? And if you're double vaccinated and exposed and not experiencing symptoms. So, you know, they have more and more coming back all the time. So they will continue to perform urgent, emergency, and priority surgeries, like, of course, cancer surgeries, oncology, provide ambulatory care, and dialysis, oncology, mental health services, etc. And they are redeploying staff to the areas with the highest needs. But certainly the Ontario numbers are huge. 3,200 people in the hospitals in Ontario, and as I said, 477 of those are in ICU, and that's up from 438, so up 40 from yesterday, from a day. It's huge. And when you think about it, just last week we had 250. It was literally 10%, because the capacity was 2,500, and now we're 20%, right? So it's huge. The increases are happening very suddenly and by great numbers. And we're worried because of further provincial restrictions that we're going to see the increase in hospitalizations and more staff shortages because of the Omicron virus, right? So what else can I show you?
Like, do you think we'll see other restrictions, or do you think that's the end of it? I mean, what are your thoughts?
There is a mood right now. There is a certain, and you and I have both heard it, that it's a flash flood. This is the way Dr. Lowe likes to present it. And it's kind of the beginning of the end, the worst of it right now. And we get through this, it will start to become endemic. And, you know, I'm very hopeful for that, and I'm praying for that as well. And I also think it's a good sign that the schools are going back. I did see a memo from Minister Elliott today saying that hospitalizations will peak in the next 2 weeks. So by the end of January in ICUs until the middle of February. And then I think they see a decline happening again, a more stabilization of the situation, because as Dr. Lowe likes to say, it's like a flash flood. As quickly as it enters, it recedes. And but as long as you're vaccinated, your symptoms will be mild, like mine were. So I really encourage people to go out and get vaccinated. If you want to look at those rates, I have them as well. So we have 82% of our population that have 2 doses. It's like 88 that have 1, and that's the 5+. Okay. So that is very, very, very good. But when you look at just 5 to 11-year-olds, we're around 40%, which is, in comparison to other municipality, other jurisdictions, low. I know that Toronto is well over 50%, closer to 60, and here we are only at 40. So we do need to put more effort and resources into that. And, you know, maybe the idea is that we host these clinics for the 5 to 11-year-olds right at schools. whatever it is, we need to have more vaccination available to them, more opportunities for vaccination.
What do you think that is? What do you think that is? I mean, 10%.
So
is
we've
huge.
had this conversation with Dr. Lowe, and he feels that, because our population is so diverse, there was a hesitancy amongst Mississaugans, Peel, actually all residents of Peel region. Initially, we were slower on the uptake, and whether there are language barriers or cultural issues. And so when we finally convinced the parents to go out and get vaccinated, and the grandparents, and now they said, okay, that's okay for me, but maybe not for my kids, right? So now we're working on breaking down those cultural barriers and explaining, yes, it is safe for your children as well, and the right thing to do so we can open schools, right? So there has been some hesitancy here in Peel region, and I know that to be a fact, because we had this conversation with the GTA mayors, and Mayor Tory was giving us hits rates are significantly higher in Toronto.
Interesting.
So,
Okay.
yeah, it really is. And third dose uptake is about 30% for 18 plus. So we need to increase that too. And you do know that we make booster shots appointments. We open up new ones almost each and every day. I know that people kind of hunt for a convenient time and location, and then they find one that's a few weeks away, and then they go online again in a day or so, and more appointments have been opened up because they obviously were able to source more vaccine, more doctors, nurses to administer them, and more appointments have been opened up. So I do encourage you, if your appointment for your booster isn't until February or March, keep going back online and keep trying, because new appointments are opening up all the time.
Any word on any more vaccination centers opening up in Mississauga, possibly?
So we are looking at that. As you know, Trillium Health Partners opened up the J Wing, and there's the Switch Health at the International Center, which is a private facility, but same rules apply. You can sign up and get vaccinated there. Dr. Lowe is looking at it. And then you also know that there is priority being given, of course, to educators and 5 to 11-year-olds. So, there are certain times, certain centers, certain vaccine centers, and certain times available for just those demographics. And particularly, even though you need an appointment, if you're an educator or getting your first or second dose, you often walk to the front of the line and can walk in because they want to get those people done quickly. Particularly the staff have been all educators' priority bookings. And that's at the International Center from 4:30 to 8. And there are pop-up clinics all over the city as well, including at many of the schools. And I do have those here if you want me to run through them. But I think a better use of time is just go on the Peel Region website, and they're all listed there with times. And, if you get a priority because you're an educator or you're elderly or you're the first vaccine, then, or 5 to 11-year-olds, of course. They're looking at more and more school-based clinics for 5 to 11-year-olds as well. Mm-hmm.
Now, I can't imagine the yearful that you get all the time in regards to the restaurants. When last week, Doug Ford announced that indoor dining and gyms are closing.
Yeah, I don't even like to smile when you say that, but because that was very unfortunate. And, let's talk about gyms first. Of course, I'm an active physical fitness buff, and I've moved, my gym is offering online classes, and I'm very grateful to Drew and Alicia Tyler at F45 for doing that for us. There's a live class at noon, but of course there's an app, and I can open the app at any time and work out at my convenience at home. Not everybody can do that, so hold on. Today I was out walking the Cullum Trail, and we were filming some video just on the number of trails we have open and available, and we're grooming all the 300 kilometers of our hiking and our bike trails and encouraging people to get outside. And I must say today it was pretty cold, -17, but I went with a couple of girlfriends and we were out today, and you really don't need all 10 toes, right? They were pretty cold. So there's that, right? And then restaurants. So these restaurants have not, and we all know that, been the source of transmission. But the reality is Omicron is so transmissible that any opportunity for people to sit down in close proximity does increase your risk. And I think they saw that as an opportunity to close down, really shut down risk for a period of time. But I'm very hopeful that, what was the date given? The 26th of January, I believe. Once they open, they'll stay open. Because I know, I speak to our local restaurateurs, local entrepreneurs, they have every protocol in place. And I know for a fact, because I visit them frequently, all the protocols. You can't go into Mississauga without having to show your vaccine certificate and walk through with your mask on, sit down when it's safe, remove it. All staff are wearing masks. I know they abide by all the rules. So I said I would also add my voice to ensure that those small businesses, like our restaurants and our gyms, open on the 26th. I think it's so important. And I'm very grateful that the personal care providers and the smaller retailers were kept open. But I also know that the restaurants follow every protocol and every rule. And, you know, it's a tough decision to make for the Premier and the team, because I know they were just looking for opportunities to shut down transmission. And it's just that the people, you know, it's less, let's be honest, than 6 feet when you sit across from somebody at a table at a restaurant. So we know that you need more than 6 feet to prevent a transmission of the virus. So I know they said, okay, how many restaurants are there? How many thousands are there in the GTA? We could shut down opportunities for transmission in thousands of locations. I think that was the thinking. I don't think, you know, it's very unfortunate. And yes, you're quite right. I hear from them daily and I'm feeling their pain. And so I do hope that on the 26th, they have the opportunity to reopen. At least they were given a few days notice as well, because you and I both know it affects not only their staffing, but their purchase orders, and they have fresh food that goes to waste. So that's very important as well.
Is the City of Mississauga bylaw officers enforcing this, or are they just more kind of educating, just walking around with their batons twirling?
So there's a lot of work for our bylaw officers to do, not twirl batons, but certainly from an education standpoint, I have not been made aware of any facility that's breaking rules in Mississauga.
Is there anything that the municipality can do to help out gyms, restaurants and stuff, or are you guys handcuffed with what you can actually do?
So our role is to enforce, and we cannot provide, in case you're asking, any kind of financial supports. Those have to come from the provincial or the federal governments, and fortunately both have announced grants. I think there was a $10,000 grant to restaurants that was just announced the other day. We're not permitted to do that. That's considered bonusing, and we're not allowed to. And in addition, we're all still in an operational deficit. We just don't have the capacity to do it. That kind of financial support has to come from a different level of government. And I know that was very challenging to hear, especially during the first wave. You know, when we went through the lockdowns, and our lockdowns were more severe, more punitive, and lasted longer than anywhere else in North America. And they were suffering greatly. Not only the restaurant owners, but all their staff. And they were looking to every level of government for help and assistance. And while we provided them with guidance and economic development support, helping them get online, helping them pivot their businesses, financial supports can't be provided from the municipal government.
Okay. I've had Andrew Horvath and Stephen Del Duca,
good. Okay.
The NDP Ontario Party and the Ontario Liberals, and I asked them a question about, you know, if they would reinstate the LRT loop. You know,
good for you. Good for you.
And Andrea said that she would, you know, she would listen to City Council and yourself, because she said that you guys know best about the city. So, I mean, at the end of the day, the election's 5 months away, if you can believe that.
I know. Did the leader of the Liberal Party say the same thing?
I don't remember, to be honest with you. I just remember Andrea's. I remember what Andrea said.
I'm sure he would, because both of them are about, you know, building cities and investing in transit and infrastructure. So you know, right. So that's very good news. There wouldn't be any discussion at my council. That's our #1 priority, in addition to all-day two-way GO train service on the Milton line, right? Those are our two top priorities.
So
from a transit perspective, as well as the Dundas Street Lakeshore, BRT's Lakeshore has been announced. I don't think Dundas is quite funded yet, but close to it. Rebuilding the transit terminal, those are our transit infrastructure priorities. But loop locally and all-day two-way GO train service on the Milton line, those are our biggest asks. Yes.
I guess that's what I was going to ask you. Is that what you're looking for from the provincial candidates come June?
Absolutely, the commitment. And don't forget the big one.
What's the big one?
Controlling our own destiny, right? Don't forget that one.
That's so inside baseball, though. Like, how do I explain that to them?
Allow Mississauga to be a single-tier municipality.
Okay. I will ask that next time.
There we go. Well, I'm sure you'll have them back. Sure, you'll have them back, right? Mississauga, we are the third largest city in Ontario. We should be controlling our own destiny. We shouldn't be two-tier. I want all my commissioners at one table, not at two. You know how much duplication that is. You know, if you get me started, I'm going to talk about this for 20 minutes. So we won't. But
well, I will ask
single tier city. Okay.
A couple of Instagram questions here. There's any word on the Port Cadet Library? Is there an allocated budget for rebuild?
Well, that's a very good question. I think we're still waiting for those engineering studies, but I think we're not too optimistic. We do want to relocate the library. Should it have to move? Yes. But a specific budget allocation, not yet. No. Because that decision hasn't been made yet either. I mean, we're still waiting to hear back. I mean, it doesn't look positive, but that's not final.
Okay. We've got another question here, and I think you kind of answered it before. It said, I can't skate. Is there any other outdoor activities that are open? And I think you've answered it.
Outdoor activities? Oh yeah, all the trails are open, lots of amenities. There are 2 outdoor rinks, of course, Celebration Square and then Woodhurst Heights. So there's two that are open, and we have also, I think the number is 43 natural rinks.
Oh no,
that are ponds and.
This question was actually, I can't skate.
Oh.
Is there any? Skate. Yes, this person can't skate. Is there any other activity?
Well, how about tobogganing hills? There's tobogganing hills. I love
hiking.
And hiking. I love hiking, and you know that. And the waterfront trail is another popular one. Oh, so I am getting a note that I have to make a correction to my stats. Okay. Because I read them incorrectly. Did I read them incorrectly? No, I didn't read them incorrectly. There are 186 individuals at Trillium Health Partners who have COVID. But as I said to you, many of those are suffering from other conditions, but also have COVID. The ones who are being treated for specifically COVID are 115. Okay. 115, yes.
Awesome. Here's another question. How are the city staffing levels during the latest pandemic?
That's a very good question. Very good question. And I was asked that at the press conference on Friday as well. And the good news is the city is in very stable condition. But of course, our staff in every department are being impacted by Omicron, as it is everyone else. So, and it fluctuates. So you can't ask me specifically what numbers in which department, because over a 5-day period, that all changes because people are either they have COVID themselves or isolating because they were exposed, or someone in their household does, right? So they keep changing, but we're at a very, very stable level right now. And we do have a comprehensive business continuity plan, right, that allows us to ramp up or ramp down. And the only business that really has, here, let me grab this 1 second, that has made any changes is our transit, the My Way service, right? We have shut down, let's see, a couple of lines. We've suspended some of the routes. That said, we're still operating almost 90% capacity, our usual daily service hours and usual routes. The ones that have been last Friday serviced on Route 101 and 101A, that's Dundas Express, and the 107 Malton Express were temporarily suspended, as well as we reduced service on the 103, which is the Huron-Ontario Express. So that is the only impact to date. and we're operating at about 90% capacity, but we do have that ability to ramp up or ramp down should we need to in all our business sectors, right? Whether it's fire and emergency services for us. I know at the region, the same with paramedics, policing, etc. At 311 also, parks, recreation, etc. We have that ability to cover for each other, and we have, other than the occasion, I think it was a week and a half ago, of the code black with the paramedics, things seem to be much more stable now as well. Not only paramedics, fire emergency services had some issues around Christmas, but that's all been resolved too. So no, things are very stable at the city, and I'm very pleased about that, but we look at it very closely.
Awesome. Well, Mayor Crombie, that's all the questions I have, unless you want to add anything.
No, you didn't get, you know what, I got my favorite grandchild for Christmas or anything like that. Nobody watched today?
Okay.
I guess they're busy at work today. Okay.
You got a lot of hearts, so it might have been them. So.
Oh, okay. Oh, see, I don't see the trailer.
Oh, you don't see them? Okay.
No, probably better. I'd be distracted. I'd be saying, what? What are they saying?
1,000 hearts. So.
Very good, very good. And the good news is, like everyone else, I was fell vulnerable to COVID, and protect yourselves. The best protection is being vaccinated. Get your booster, and the same rules apply. Try to keep your distance and wear your mask as much as possible. If I can get it, anybody can, and I'm careful.
Thank you very much, Mayor Crombie. I'll see you in 2 weeks.
Yes, thank you.
Later.
Bye-bye.